Another common question that I get is, what is pelvic floor physical therapy? So, pelvic floor physical therapy evaluates and treats any issues that you may be having related to your pelvic floor not working quite the way that it needs to. In addition to that, it also looks at surrounding areas because no area of the body works in isolation. So, in addition to examining the pelvic floor, it also looks at the lower back, the hips, the rib cage, kind of that whole region that may affect function in the pelvic floor. So, what that would look like is a detailed kind of subjective history, which means just asking a lot of questions about kind of what is going on to get an idea of what may be causing what is going on for you. And then after that, there's an examination that can be just looking at how things are moving through your back, through your hips, look how the muscles are functioning, watching how you're breathing, and then looking more specifically at the pelvic floor. That can be done either internally, either vaginally or through the rectum, or it can be done externally, just feeling the muscles from the outside and seeing how those are working, or it can just be done through a line of questioning and just seeing when the symptoms come on, what kind of movements, those sorts of things, just kind of depending on the individual's comfort level. So it doesn't have to be an internal exam to have significant improvements. So what does it mean when your pelvic floor isn't quite working as well as it should? Like, what should you be looking for? The types of things that you would be looking for would be if you're leaking any pee or you're leaking any poop at any time that you're not planning to go to the restroom. It also looks like peeing more frequently. So if you're going to the restroom more than every 3 to 4 hours, or if you aren't able to hold it once you get that urge to go to the bathroom. It also looks like pain in any of those areas, okay, in your lower abdomen or in your hips or in your pelvic floor itself. And that can be sharp, stabbing, shooting, dull, aching pain, any types of pain there, numbness, tingling, that kind of stuff in those areas. And finally, it can be having pain with either penetrative sex or with use of menstrual products such as tampons or menstrual cups. So if you have any of those issues, you may benefit from speaking with a pelvic floor therapist or even receiving some treatment for those.